Hi everybody, Dr. Paul here from Absolute Dental Care. Today I thought I would talk about crowns and porcelain bonded restorations, or onlays, which is the same sort of term, of going through the process of right from when the patient first sits in the chair, the whole process of taking that impression, as well as putting that tooth in the crown or the porcelain bonded restoration into place some weeks later. Well, the main reason why we look at strengthening a tooth is because it's got a crack in it or it's heavily filled, and we don't want that tooth to break down anymore. So putting a cap or a crown around the outside of the tooth, or a porcelain bonded restoration, which is a 3/4 crown if you like to look at it that way, helps hold that tooth together to help prevent breakage. So when the patient first comes in and we decide that we're going to do this, we numb the patient up, and to make sure they're nice and comfortable, we take a small impression to start with to help us make a temporary restoration in that same visit. We prepare the tooth, we trim it down to the right height and shape, because obviously we've got to take the tooth down a little bit, so we put the crown on the top of it, the crown will fit. If we don't take any tooth away, then obviously you won't be able to bite together properly. So we trim that tooth up, we mill that tooth up into a nice shape, we take a very accurate impression of that, and these days we use a digital impression and this little device here, which is our intraoral scanner, and we put that inside the mouth so that we actually take that digital scan. And here's a scan of someone that we've done before, and this particular tooth here, as you can see, there's a bit of a gap around it. It's where we prepared a particular tooth for that. So rather than using these big gooey impressions, we take a digital scan. It's much more comfortable for the patient, and it's much more accurate as well. In fact, it goes down to about 5 microns for all those nerds out there like me, which is very, very tiny, so it's very, very accurate. Once we've got that impression and the bite that goes with it, so we do the upper and lower jaw, and then we take a bite scan and actually puts those two digital models together. And then the boys in the laboratory down in Sydney actually use this to their advantage, and they design the crown electronically, and they actually make that crown out of a solid block of zirconia or porcelain, and then they send it back to us a couple of weeks later. Once we get it back, we then take the temporary crown off that we've put on there, which has protected that tooth for a week or so. We clean the tooth up, and then we glue that crown into place, or cement that crown into place, or the porcelain bonded restoration, to then seal up that tooth properly, and then it's permanent inside that mouth. That then should last you a good 10 to 15 years on average. That's what the good book says. Some people, it lasts a lot longer than that because they really look after them, and the crowns were done very, very well, and that's what we want. We want people to make sure that they look after it so it lasts as long as we possibly can. And that's the process of going right from the impressions and the preparation of the tooth right towards putting that tooth in. Once again, I'm Dr. Paul from Absolute Dental Care. If we can ever help you, if you've got any queries about crowns or anything else, please give us a call, and we'll look forward to talking to you next time. Take care, bye-bye.